Hello and welcome back to the Original Medicine Podcast. This episode is going to be almost like an add-on to the episode that I did about dry needling. In that episode, I talked about the concern for dry needling based on the little training that is required for someone to do this technique and the drawbacks to it. But what I didn't get into in that episode is if you are someone who suffers with tight muscles or is an athlete and finds themselves having recovery issues and you're looking for this modality to serve that purpose, what should you actually be looking for? Because I think in that episode, I make it pretty clear that dry needling is not only very unsafe, but is also not effective. But in this episode, I wanted to talk about what is effective and what can we do for tight muscles. So let's start there. We do want to avoid dry needling because it is a really aggressive technique that creates damage in the muscle, and the thought process goes that when the muscle recovers that it is healthier or more relaxed or something along those lines. This is not Chinese medicine at all. And in Chinese medicine, we're always looking deeper. We're looking under the hood, as I like to call it. So if we have tight muscles, that is not due to something superficial necessarily. When I say superficial, I just mean it's not something that we can just say, oh yeah, just shove a needle in that muscle real aggressively and we'll get it to relax. That may be true, but in Chinese medicine, we're a little bit more sophisticated than that. And we want to understand why and what caused that muscle to be tight. So the Chinese medicine principle goes that blood is what bathes the musculature. So the fascia, the muscles, the ligaments, this kind of thing. Blood is kind of like oil in a car. So if you're not familiar with Chinese medicine or with acupuncture, blood is this concept that is both physiological, just as in the allopathic model of the body, but it's also energetic. And so when we think about muscles being tight, that tells us that we are deficient in some sort of fluid. And most likely we're thinking about blood, but classical Chinese medicine, as opposed to traditional Chinese medicine or TCM, goes a bit farther and acknowledges that there are components in the body that contribute to the manufacture of blood. So we also need to think about thick fluids and thin fluids, okay? So when we think about treating tight muscles, if you were a patient that had chronically tight traps, let's say, and I've seen this in the realm of migraine patients, they come in and they say, like, I have these really insane headaches. I also have migraines and I get a lot of neck tension. I think it has to do with my job or the stress from my job, the physical position that I'm in at my job. All of these things are true, but they are really an example of the underlying problem, which is that you are deficient in these resources, okay? So how would we go about treating them? In the treatment room, if I'm in person with someone, I'm always going to take their pulse and see what's going on, okay? And the pulse, which I have not talked about very much on this podcast, maybe not even at all, actually, now that I'm thinking about it, the pulse tells us about the organ system and the channels. So each wrist has 3 different positions, and those tell us about 6 different organs on each side. And it also tells us about how they interact with each other, because we always say in Chinese medicine that everything is related. Truly, Chinese medicine is very holistic. We don't look at one organ by itself, which is different than what we are taught in school. In many cases, people will look at a pulse and feel one position versus all of them together. And they're also in school, we're not taught how to see if the organs are talking to each other. And that's really an invaluable skill for us in practice so that we can know where the problem is coming from. So let's say, for example, the person that comes in with the tight muscles, they've got tight traps, tight neck up into the occiput. Okay, that sounds like it should be quick and easy, right? Except for not, because when you get into the pulse, you see that they have an 8 extraordinary pulse. This is a constitutional level pulse. It's a very deep level of energy. And what that tells us is that something was affected in their early life that led to perhaps, and I'm literally just making this up as I'm going, this is a possibility. This is a very real possibility. This, whatever happened early in their life, could have affected a channel that then affected the body's ability to produce blood and other fluids. So now they're operating kind of on a deficiency. They don't have fully what they need. So what we're going to do in practice is treat that deep level first, because that's what's showing up in the pulse. And again, like the pulse is a communication between the patient and the practitioner. It's never a situation of where somebody comes in with a symptom and then I just spring right into action knowing what to do. I want to know about the person. And one of the ways that I find out about a person is through their pulse. And so in this example that I'm giving you, there's a very deep level problem that has now manifested itself as tight traps, tight neck, etc. Okay, however you want to call it. So we would start there. And then as we work together, we may use other channels, but the idea is going to center around building more resources, because when there are more resources, the muscles are bathed with the resource. Okay. And so then they're not tight and dry and painful. You could also think about this like a spare bike tire. If you have it hanging in your garage and it hasn't been used in a while, it's been outside kind of like exposed to the elements, it will get dried out. And then when you go to put it on your bike, that doesn't work because it just cracks, or it might crumble around the edges, or it's not pliable any longer. And so you can think about your muscles and your musculature in the same way. If you have chronically tight muscles, this is probably because you are under-resourced in some way. And so what we need to do in the treatment room is work on what is true for you, what's applicable in your situation. But generally speaking, from a Chinese medicine physiology standpoint, there's some deficiency of resource that we need to rebuild. So we do that, again, in the treatment room based on what your pulse says. We can also use bleeding treatments here to release stagnation, because when we are holding something stagnant in the body, this creates heat, and heat creates dryness. So that can be a really useful way to treat as well. And then also we can treat the sinew layer, which is the most exterior of all of the channels. Now, if you're new here, you may not have heard me talk about this before, obviously, welcome. But Chinese medicine has a view of the body that's most exterior to most interior. And different levels are affected at different times. Different things create like a blockage, like a stagnation, an issue at those different levels. And so we have to treat at the appropriate level. So as I mentioned, the pulse that shows a constitutional level problem, that is a deep needling technique. We're treating a deep level of energy, but the alternative is also true. If we feel something very superficial in the pulse, also there's another way of diagnosing that superficial layer. If someone has tight muscles or like a lack of range of motion during a certain movement, that often can be a very superficial layer of energy that's affected. And that's a different kind of treatment. That's called a sinew treatment. And we can often free people's range of motion entirely. So when the dry needling world talks about using dry needling for professional athletic recovery, this is one really dangerous, because a person who is using dry needling has very little training in doing so, and they have zero training in Chinese medicine. So I'm very opposed to that method, because you're using a tool from Chinese medicine, but you don't actually have any Chinese medicine training. And I think that is just not responsible. But secondarily to that, you're going into the body with this tool of Chinese medicine, and you not only run the risk of a pneumothorax because you are poorly trained, but in addition to that, you're not trained to know how to use a needle to build the resources that this person needs to effectively recover, or either clear the sinew layer. There's a lot more to it than just putting a needle into the body. And they're very, very effective ways to help people recover from athletic injuries, from athletic strain, or if somebody just chronically for years on end has chronic musculoskeletal issues, painful joints, sore muscles, maybe they have an autoimmune diagnosis, we can absolutely help with that, but we have to know where they're coming from. And we have to, as a practitioner, understand Chinese medicine physiology. We can't just willy-nilly put needles in the body. So beyond needling, what would we also want to consider when somebody has chronically tight muscles? Whether that's an athlete or not, okay, same difference. We want to consider the diet as well, because we can also get into herbal support. We can use Chinese herbs to help this process. But if we're prescribing herbs and we're not also working with someone with their diet in order to be more deeply hydrating and nourishing, the same thing as just prescribing a medication and not looking at lifestyle factors, okay? So when it comes to diet, if you've been around here for a while or on social media, you've heard me talk about warm, wet food. So we want to have a diet that is hydrating and nourishing. And this means mostly cooked food. It means minimizing raw food because raw food takes a lot of energy to digest, and it also takes a lot of fluid from the body to digest. So we want to eat things that are as easy to digest as possible, which means cooking them and having them be warm temperatures, okay? It also means looking at the things that create heat in the body and trying to reduce or eliminate those. And the big ones are alcohol and coffee, chocolate, onions and garlic, and then hot spices. Additionally, anything that's not real food, things that are like highly, highly processed, are going to also give our bodies trouble because they just simply don't recognize it. And that can create more heat in the body. Again, heat creating dryness, and dryness leading to not having enough resources to bathe the muscles and keep them nice and soft and pliable so that they feel good and not tight. And again, once we have accomplished that, having wet breakfast, having warm water in the morning, eliminating these drying things from our diet, we can make major improvements with our recovery. In addition to having the acupuncture treatments in the office, then we can also consider using Chinese herbs, which are going to support what we're already doing in the treatment with diet. It's just going to be one more layer of treatment. To summarize, there are really great ways to use Chinese medicine to support nice, comfortable muscles that are not tight. We can alleviate muscle tightness with Chinese medicine. The way to do that, though, is not through dry needling. It's through a conscientious use of Chinese medicine. It's to ground your practice of Chinese medicine in the principles of the medicine, which is really using Chinese medicine physiology to say, what is going on here when someone has XYZ symptom? And what is it about this person based on what they're telling me, based on what I feel in the pulse, based on what I see in their tongue? How can I help them rebuild the resources that they need so that they no longer have the problem that they have? Our problems are just signs for us telling us that something's not quite right. And then once we have these pieces of the puzzle, we can fit it all back together nicely so that the person no longer has those problems. So whether you are an avid athlete looking for help with recovery, or whether you have chronic muscle tightness because you have an autoimmune diagnosis, it really doesn't matter what the reason is that you think you have muscle tightness. We can help with Chinese medicine, but we really do need to take a deeper look than just sticking a needle deep into a muscle and expecting it to relax. You're essentially traumatizing a muscle. And if there is trauma in the history of the patient, whether that is physical or emotional, there are so many things contributing to the reason that a person may have tight muscles that we really need to be thoughtful in our approach and make it specific to the individual. If you guys learned something from this episode, if you know someone that you think could benefit from this knowledge, can you please like and share this episode with someone? Rating this episode really helps me get the message out. Chinese medicine is not a soundbite kind of thing. It is a deep, really beautiful system, but it is also really simple once you get to know it. And I think more people could benefit from learning about Chinese medicine. So I hope that you will share it and connect with me over on Instagram, where you can ask questions and give me suggestions for future episodes. Thank you so much for listening. See you next time.